private equity firms have been buying up hospitals and hospital real estate across the country. In 2026, Connecticut stepped in to limit one specific practice. The law is Public Act 2622, signed by Governor Ned Lamont. He signed it on May 27, 2026, the same day as the hospital tax law we covered earlier this year. It passed with big bipartisan majorities, 27-9 in the Senate and 130-18 in the House. It started as Senate Bill 196, sponsored by Senate President Martin Looney and Representative Nick Gauthier. At its center is something called a sale-leaseback transaction. Here's how it works. A hospital sells its own real estate to an outside buyer, then immediately leases that same property back so it can keep operating there. It sounds harmless, but critics say these deals can drain a hospital's assets and saddle it with new rent it never had to pay before. Starting July 1, 2027, Connecticut hospitals will be banned from entering these deals, but only for one specific piece of property. The ban applies to a hospital's main campus, defined as the licensed premises where most of its inpatient beds are located. It does not apply to other hospital-owned properties, like outpatient clinics, physician offices, or administrative buildings. There's also an exception. Hospitals in genuine financial distress may still be allowed to enter one of these deals, under specific circumstances. The law's second major piece deals with private equity ownership itself. It defines a private equity entity as any entity that collects investment capital and uses it to buy an ownership share of a hospital, directly or through another company it controls. Starting by February 15, 2027, and every year after that, every Connecticut hospital must submit a formal attestation to the state's Department of Public Health. That attestation has to state that no private equity entity holds a controlling interest or ultimate governance control over the hospital's main campus. It also has to confirm that no private equity entity can direct policies affecting clinical decisions, things like patient discharge timing, diagnostic testing, or observation status. If a hospital fails to file that attestation, it faces a civil penalty of up to $2,000 per violation. The law does include some carve-outs. It doesn't prohibit hospitals from investing in joint ventures or having standard agreements with physician groups. It also doesn't interfere with normal coordination between a hospital and its parent healthcare system. So why does this matter? Supporters point to a national trend of private equity firms buying hospitals, then using sale-leaseback deals to extract value from the real estate. In some widely reported cases elsewhere in the country, that strategy left hospitals financially strained, sometimes closing entirely, after the real estate was sold off. Connecticut lawmakers say this law is meant to catch that risk early, before it happens here. This pattern is playing out across the country, and Connecticut is one of a growing number of states passing similar oversight laws on private equity in healthcare. Some in the hospital industry have historically defended sale-leaseback deals as a legitimate way to free up cash for equipment, staffing, or renovations. That's likely part of why the law includes a financial distress exception to avoid cutting off a legitimate financial tool for hospitals that are already struggling. But for most Connecticut hospitals, after July 2027, the main campus itself is simply off the table for this kind of deal. And starting a few months earlier, every hospital in the state will have to formally certify, in writing, exactly who controls it. Annual private equity attestations begin in February 2027, and the main campus sale-leaseback ban takes effect in July 2027, both under Public Act 2622. Is this the right way to keep private equity in check? Or could it make it harder for struggling hospitals to raise cash? Let us know what you think, and if you learned something new, hit like and subscribe for more breakdowns of the laws shaping Connecticut.